Hi, my name is Anita Dickson. I'll just, as we're queuing up for my presentation, I'm the president of the LPN Association, as well as I'm also a member of the BC Coalition of Nursing Associations. So I'm really excited to be here today and to present to you some from a frontline perspective. So I am a frontline worker. I am working in different areas. I've zigzagged through leadership positions as well as now coming back to the front lines, and I was also an educator for both the HCA and the practical nurse program. So I'll be talking to you from different perspectives that way. Is it going to just keep going? Oh, it's going to do that. Okay, good. We'll leave it at that. I had it that time, but we just didn't know whether or not we were going to be doing it. So quickly, I just wanted to show you for this slide is that we know that people are living longer. What I want to bring back is what the BC Care providers presented was the sandwich generation. As people are living longer, they're definitely having the stress of taking care of their children as well as their adults. As their parents. And then now we're looking at collaborative, we're looking at assisted living as well as in any type of dwellings. I was a manager of an assisted living. Our average age group was actually 88. So we're looking at 88 and going from there. I have to pose the question, oh, now it's going really fast. Okay, good, we'll go for that one. I have to pose the question, and I'm going to be courageous, because I've now spoken at many different forums, and I'll just let those teams as we're talking. I've posed this question many times, and I've heard nursing leadership pose this question many times. Do we have a shortage, or are we just needing to look at our resources and have them in the right areas of practice? So I definitely would like to again, think as we're going through the different slides, is that we may have some innovation just right now here today as part of our solutions. So I like to go to that pillar again, honoring BC Care providers. You've done an incredible report. I want to go back into investing in the people. We want to improve, and now I want to say to our Minister of Health that I'm a little nervous because I also quoted some of these numbers. So I don't want you to leave, though. You can see it. It's that, we want to be able to increase. We need to do that. So yes, you're absolutely right. In the reports, in all of the data, we need to increase. I can say as a healthcare provider, it is absolutely imperative that we increase the amount of staff to be able to provide the direct care at the point of care. HCAs and licensed practical nurses, and then having the other allied people in residential care. And I see that also in supportive care or assisted living. I also really want to honor and now highlight, if we do have any money for this supportive living, is that 15-minute to increase to 30 minutes. That is so needed. I used to work, and I still work, I worked in an emergency department at Royal Columbian for 16 years. I now work in a smaller community emergency department. I see people coming in and out and say, I have care workers that came to help me, and then they sent me to the hospital, and it's because somebody wasn't able to stay there long enough for them. So I have to honor that. I just wanted to then shout out the LPN and HCA team. I think this is one of the negative connotations that I hear all the time, is that we don't feel valued in the healthcare team. We don't feel that. And I will say that from true, from experience. And I'm right now working casual in many areas. I work in palliative care, I work out in ambulatory daycare, I work in surgical daycare. I'm also working in acute care. I work across all the sectors. I listen to the people out there. So I really feel that, in supportive care, in residential care, LPNs and care aides are the leaders. We want to be able to bring our solutions forward. And I know that it's difficult, and I will absolutely acknowledge from the leadership perspective, because I was a manager of an assisted living, it is not easy to do that balance. So, again, I think that we have some innovation sitting in the leaderships there. We just need to listen for them. I want to also acknowledge to the education and training. I think the education we did here, as I was, stated that I was an educator in the HCA program, we were hearing about the seats were not being filled. I think one of the issues that, again, we need to bring forward is honoring that this is a wonderful profession. What I hear and what I know is everyone saying, you're young, go straight to be a registered nurse. Don't stop, just go for it. That's your investment added. And some of them going like, oh, okay, well, I was thinking about being an LPN. I see it all the time. Don't stop. If you can, go straight to the higher level. Also in British Columbia, our educational system and in our academic system, there is more push, especially for the younger generation, to have a degree. We have to also understand and recognize that. I listen to that for all of the younger people, is that, you know what, I'm going to have you stay at home, I'm going to have you live home, and I'm going to make sure that you go out and get a degree. So certification is looked at as an embarrassment. I cannot tell you how many of my girlfriends say, I'm just an LPN, I'm a diploma, I'm going to have to go back to school. So I think we need to maybe then be able to do some more shout out, and that's part of what to messaging to move that forward. Okay, scope of practice. As we're moving forward, I will focus a little bit on licensed practical nurses, because that's something that I wanted to state. The report that came out from the ministry just yesterday actually supports that LPN scope is probably the most misunderstood. It is a fact. It is out there. People, and even LPNs themselves, but all across all the nursing sectors, we don't understand what our scope is, and we're looking at wanting to maximize and optimize all of that. So I think that for our regulations, I know that there has been some removals of a lot of barriers, and it is definitely moving forward. And I don't want the ministry's people here to think that you haven't done great work, and I know it's actually even moving forward. It's just, again, the speed of what we need to have these things move forward. Regulatory framework. Okay, so we know the education has been standardized. I think the Ministry of Advanced Education and all the private colleges, they've done an awesome job. We've got our education, it's now upgraded. We've now got the legislation, government did an amazing job. 2015, we've got our regulations for all nurses to be able to be changed to match what we need to across the system. The regulatory bodies all got together and presented and now have a good framework for the regulations. Where we are starting to stagger a little bit is at the employer level of this competency framework. The employers are still, there's some policies, unfortunately it's more in the public sector. The policies specifically also around LPNs and carries are old, haven't been increased, don't know what to do. Some of the limits and conditions for licensed practical nurses in the acute care sector is, well, you need additional education. What does that look like? They don't know how to move it forward, so it tends to stay there. So I think that's where we have some work to be done. And then they come back to the LPNs themselves and even registered nurses to say, what can you do? Or what can't you do? And it's like, I don't know. And so there is a lot of work, and we definitely have some innovations around there. We know that healthcare systems need to change. This is worldwide. It's national, it's international. Everyone is looking at their models, is looking at what they can do. And then when you marry the business model with having a health human resource and delivering services to humans, it is not easy to stay within the budget, and that's what we hear, and we understand that. So I just wanted to acknowledge that. Healthcare workers. Okay, I have to give a shout out for the carries. It's a 24/7 business. It's one of the more unique businesses that we can't shut our doors. We have to keep things moving. It constantly is coming, especially in the emergency department. That's probably one of the most difficult areas that you see, is that door does not shut and there is no stopping. Up on the floors, your capacity, even if you have hallway nursing, hits a limit, not the ERs. And then you have all of the stress in regards to that. Carries, even at the point of care, I know we're working on it, but when you actually talk to each other, you're talking about word of mouth, and you're hearing there's only one LPN who's giving meds for 35 people, and I can't keep up, and then you have two carries, and they have to go down a hallway by themselves, and they're having several people to have to do lifts. Not easy. And they don't have their partners, because their partners is on the other side of the building trying to answer a call bell as the nurses. So if there is, some issues, I see that, I know that there's work to be done, and I know that you're listening, and that's what this whole forum is all about. So I want to bring a positive note to move you forward to talk about innovation and flexibility from our perspective. Forget about the 500 million. I have to tell you, as you're presenting, I was cringy. I was and I'm glad that Isabel's got so. But it's important. sure. So I have to go with it. So we have that. So the 500 million, but if we can be looking at that, awesome. That's all, you know, then we'll just leave it at that, and we'll just move forward. I know. God, I have to be the last speaker to have that. Oh, but we do want to acknowledge 900 workers, yes. But what I want to say in regards to those workers is that I do believe the workers are out there. I do think that we have to be looking at, there is, and it's already been said a couple of times, and I want to emphasize this, there is people out there that are holding at least 2, if not up to 4 to 5 jobs. So I do feel there is some work to be done, that we need to be looking at the why. Why are you having so many positions? And having to move forward, the structure of being casual versus part-time and then full-time. So there's been a lot of great dialogue that's exciting for me, but then how do I get that to the people? That's really also something, they need to hear that. That's exciting for me, is for the actual care people to hear about that. Okay, from the seniors report, we want to be looking at, you know, for home support hours, because home is best. I have spoken to people from the residents when I was at the resident care home, and I have to be careful. Yeah, oh, that's so poof. Just want to make sure I check myself in on that one. Is that, you know, they say they don't want to come there until they need help, and even if at that point they want to be able to stay as long. But and actually it was acknowledged in one of the speakers here, is that Northern Health actually has been able to meet some of those hours. But I do agree, I know that down in Fraser and then also on the island and from the interior health, we've had some growth, especially down in the lower mainland. So I think that's somewhere where we're struggling. Across all the health authorities, home support hours is what we need to be able to include. We need to be able to increase that. There's also what I have here is what they call short-term hours. That's not included in those hours there that we're talking about, but that's when someone goes to the hospital and just needs a little bit of support when they get back for a short period of time. That one tends to, for the most part, in statistics, extend to longer needs, because now that they have somebody coming in and helping them get dressed, they're going like, oh, I really could use that help, but it's only funded for 2 weeks. So that might be something as we go through and see as they're going back home, is because then they can't afford it after that 2-week period is up. Okay, I just wanted to take an extra minute on this one. I did some my own statistics and did the High here. So this is now from statistics, and we noticed that in a lot of literature we're compared, British Columbia compared to Alberta and Ontario. So when you look at Alberta and Ontario, we're actually on pretty good par in regards to ratios, and this is a staffing ratio that I took from the statistics there in the hospital and acute from LPN to RN ratios. We look at nursing homes, long-term care, we're pretty on par with those two key provinces. Where we can improve is in the community sector. And this is something that when I was working as a practice consultant, I saw the statistics, and it's still there today in 2016, is that we still can improve by putting more LPNs in the community sector that will be able to help support this piece. And I just wanted to note in the High, they were reporting 10,000 LPNs that were in the workforce, and then I went on to the LPNABC registry. There was 12,940. There's a difference. Where are those people? They were looking for somewhere. So I think you have some places for that. Okay, support, just to quickly go through, home support. It does not include grocery shopping or driving, but that's where we're finding from the action plan is that we know that people are saying, I want help, I want more freedom, but I need to be able to get to the doctor, I need to be able to stay in the community sector, so I need to have the support. So I think you guys have already said that there's some really innovative supports of having maybe a home support. So having like a 2-tier of the HCA might be the route to go, because the other statistics in a wonderful article that's actually on the BC Care Registry is that they did recently a survey and posted up that meal preparation in support living or down in home, housekeeping, laundry, that's what they want to be able to do. Okay, so this quality indicator supports what Daniel also says about social isolation. Having somebody come and visit them is really key. So I just want to pose a few questions to you in closing. What if healthcare assistants were given the flexibility to alternate their services to be able to do their visit for the clients? And what I want to say to you is my experience of talking to them is that you'll have a care plan that's designed by a nurse who then the healthcare assistant or the care aide will come in and say, I'm here to do your shower today. And the client says, I'm not feeling like it. I don't want the shower. The care aide goes, okay, refused, leaves. Instead of staying and maybe talking to the client. But they don't have that flexibility at this point, so maybe we need to be looking at that piece. Licensed practical nurses being able to assign functions. Right now there's a huge confusion on can they assign or is it delegated? We need some work on languaging for that piece. And then the last one I wanted to be able to do is looking at community care and increasing the LPNs. I really do feel that there is a role for them. I think the clarity on what they can do in their scope is what is some of the barriers, and we can work on that. Supportive living, increase HCAs to provide that and collaborate and do somewhere part of the care planning. And then residential care, I think that the HCAs being able to support, and there's a lot of evidence on that in there. So I just want to thank you for that.